I've been here at U of M for almost 30 years, and my responsibilities are varied. I run the Clinical Scholars Program, soon to become the IHPI, Clinician Scholars Program. I work with a lot of junior faculty. I've sort of carved out developing mentorship plans for new faculty. And then I'm an investigator at both the VA and at the University and School of Public Health and do my own research. I'm interested in those things that are important to primary care. And I'm interested in those things in medicine that make the biggest difference in the public health. People might not think that these are related, but depression is something that most depression care is taken care of by primary care providers. Most preventive care is done by generalists. So I'm interested in how you bring the best evidence of what affects the health of the public that primary care providers are often the lead on. So that's diabetes, heart disease, joint problems, preventive care, common mental health problems like anxiety and depression, and trying to think of how we can also build tools that primary care providers can have the information they need at the time they have that individual person in front of them. Research that I've participated in or led over the last 25 years really affects everyday practice of medicine. That reward of the rigorous science, but also seeing real-world impacts is just fantastic. The biggest problem that I see we have is we are both overspending on things that are wasteful and that we are not providing, particularly at low cost, those things that are the most valuable. I see healthcare as having distinct areas. There's things that should be a right because they're so valuable to people, but there's things that really have small marginal benefit. How do we really come to grips that there's a point in which those things are much more of a commodity? That yes, we'd like to provide everyone everything, but we can't do that in our society. So I see that bringing more value and coming to grips that some lower valuable care might not be as much as a right, but let's make sure we take those things that are extremely valuable and make sure that all Americans have access to it. IHPI is fantastic. It's literally changed my work life and my professional life. IHPI epitomizes the idea if you put people in close proximity who are all driven to do really good work, to really have good scholarship and application, that it allows that group wisdom to be shared more freely. It helps us recruit better people and retain people because your intellectual environment for a scholar, for somebody who wants to make innovative change, your intellectual environment is your most precious resource other than your own time. We're really at a very concerning time. People are paying more and more out of their individual pockets for health care. What I would like to see is that things that are highly valuable have few financial barriers, and that those things that are less valuable, that both the physician and the patient are given the information they need to assess whether that's the right choice for them. What IHPI also needs to do is reach out and knock down some of the political barriers and say we all are invested in people having good information. Right now, that future does not exist, but I'm hoping IHPI can play a large part in getting to a more efficient and equitable healthcare system.